I'm giving you work. Isme, there will be questions that come. If there are questions, you ask me. Or comments. Whatever comments are coming, you tell me. People have started joining. Hi, good afternoon, everyone. We'll wait a couple more minutes. More people are going to be joining this session. Those of you who are already in the group, you can hear me, who are in the live right now. Can you please tell me if you can hear me properly and you can see me well? I've got the mic, so you should be able to hear me properly. If there are comments, let me know. Yeah? People can hear me? Okay. Guys, please don't put any comment in the YouTube. I can see some of you have put in the YouTube में comments आप डाल रहे हो. That's okay. अभी मुझे ऐसा दिख रहा है. But the best thing to do is to put it in the group that you're already in, that I've created for this workshop. उसमें अगर डालोगे तो मैं बाद में देख सकूंगी and I will be able to address your questions there. Okay? All right. Great. I'm glad it's clear. You also know that today we are doing a foot camp. We will be discussing why that's important as well. But let's get started. Give me 1 second. It's in the group. That is the link. मैं ये बंद कर रही हूँ. Okay, so let's get started. Thank you so much for being here. Back pain as a topic is a vast topic. It's a huge topic actually. But I'm hoping that today I'm going to cover some basic things which sometimes can be absolutely new for you, but some of them might be a reminder of what you can do to help your back. So that's what we are going to do today. Before we start, there are a couple of things that one I want to know about you. And the other is I want to tell you about myself. Some of you are new, you are not new, I know you. But some of you are absolutely new to me and to my work. If you are new here, if you've never attended a single workshop of mine before, please say new in the group, in the back pain ka group for this workshop. Hoping to hear from you. Just put in the group, tell me. Are you absolutely new today? You have never seen any of my workshops before? New. A lot of them are new? Okay. All right. Welcome. Welcome to this workshop. I'm glad you are here. There is a lot of insights that are coming your way. Some things that, if there are things that absolutely are new to you and you think this is like a light bulb moment for me, I didn't know that this was possible, then please group mein daliye, because it will help me understand what has helped you and what hasn't, right? So just a quick introduction about myself. I'm Dr. Rajani Patil. I'm a spine and sports physio. That's my specialization. I have been practicing for over 23 years. My first 10 years of practice was in the US. In Raleigh, North Carolina, and the last 13 I've been here in Mumbai. Shivaji Park is where my practice started, and that's where I've been all this time. This is my clinic. My clinic, I cater to, of course, all kind of physiotherapy needs. We do everything. We don't turn anyone away. But what I specialize, and this has been my passion, is to help people with spine issues, back pain, upper back pain, neck pain, everything related to posture, all those things. I do a lot of prevention things also. I work hugely with runners, and of course runners with back pain also is quite common. So these are the things that I do in the clinic. If you want to know more about me, you can be in my forum. I have different forums for health and wellness, for runners, for cyclists. So if you're not part of those forums, please let me know and join. Yeah? Okay. So before we start, I want you to tell me your reason for being here today. Your reason can be, number one, that you have back pain now. When I say back pain now, it means over the last 1 week or 2 weeks, you've been having some back pain. So that's your reason number one. Please put one if that is you today. You have pain now. The last couple of weeks, at least, you've been suffering from, or week, 2 weeks, you've been having some discomfort and pain in the back. Number two are those people who, if you've had pain in the past and you are worried कि वो pain वापस आ जाएगा, because back pain does tend to be like that. So if that's you, put number two. If you've had pain in the past, not necessarily today, but you want to know how you can empower yourself with information and with knowledge so that you can get rid of pain. Number twos are more? Okay. So please put it in the group so I understand. Some of you are putting it here in the YouTube live, but I would prefer that you put it in the group. So more twos, more twos. Okay. All right. And the third, number three, if you have never had back pain in your life before, but you want to know this for a friend, for a family member, you want to understand back so that you know how to help yourself or your family member. So any threes, please put it in the group. All twos. Okay, good. I'm glad none of you have acute pain right now, because that means that it needs to be actively treated. Fine. Okay, now that I know you guys a little bit better, let's talk about back pain in general. Have a seat. Let's talk about back pain. When I'm talking about back pain, I am not talking about neck pain. I'm not talking about thoracic upper back pain, because these are very different things. I'm talking about low back pain, which happens to be the most common thing in the world globally. Back pain is one of those top things that happen to people. And I think, and the reason why I work in prevention space so much, I do a lot of workshops and courses in order to prevent any kind of pain starting in the first place, is because I know for a fact, and having worked 23 years plus with people with back pain, I know for a fact that back pain can be absolutely prevented. And if you've had this in the past, there are ways to completely get rid of it. You never have to suffer back pain again. Okay, this is a powerful statement, but absolutely true. Now, who are the exceptions for this? People who have really bad sciatica. You guys understand sciatica, right? You know what sciatica means. Sciatica is basically a layman's term of saying that pain pair mein hai. So pain that goes from the lower back into the leg, down into the foot. Sometimes it's also with tingling, numbness, and with reflex loss, with changes in the strength in the leg. These are people who need to be treated medically. So if you are somebody who has had sciatica in the past and you have recurring sciatica, I would highly recommend that some of this information is going to be useful to you. But I highly, strongly urge you to please meet. Hi, you can start with the foot thing. I would highly urge you to see a medical professional that is right for you. Fact, back pain is completely preventable. Also fact that it's the most common thing that happens to people globally. Also fact that it can completely go away if you do the right things at the right time. Now, the problem with back pain is that it is so frequent, right? मतलब समझो एक बार आपको back pain हो गया है, it's one of those things that वो फिर से आएगा. Flare-ups are very common. So it's very difficult to treat people with back pain in one way, because this is a basic understanding they must have कि flare-ups are a part and parcel. क्या होता है? It's like समझो एक नल है, नल में होल बन गया है, उसको आपने रिपेयर किया, किससे? आपने उस पे you put sellotape, you put lots of things on it. But does that hole remain vulnerable to a leakage? Yes, it remains vulnerable to a leakage. Your back pain is like that. Once you have back pain and you have successfully gotten rid of it, there are some rules that you can follow in order to make sure that the flare-ups don't happen. But still, it's quite possible that it might happen. The best thing that you can do with somebody with a history of back pain is to understand what are the triggers and what are the causes and how you can manage them. Managing back pain is a big topic. In fact, I have a playlist on that, exercises that you can do in order to stay pain-free, and a lot of info. I do have a playlist, so I will share all of that in the group that you're in. So watch for that, right? All right.
Someone has asked that should I make this session or you have something planned for the currently people who have
back pain? Yes. No, they can attend. Definitely. So people who have back pain now, please keep watching, because I am going to talk about what you can do now to manage it and how to take it ahead from here on. People who have had back pain in the past, there's a lot that you will understand and you can carry on through life so that you don't have another episode. Episodic back pain is the term. Back pain that comes recurring and frequent. You guys all have had back pain, right? Had, not had. And it has comes and goes. Comes and goes, yes. So that's what we are talking about here. Stiffness in the back, yes. Spasms, yes. Great terms, we will come to that. So stiffness in the lower back, spasms, these are all part and parcel of the symptom of mechanical back pain, right? Now, another fact remains that most people will say, why do I have back pain? Don't you have that question in your mind? What is this back pain? Kyun hai? Why do I have back pain? And especially when there is a bad episode of spasm, then people will ask, अरे why me? मुझे क्यों बार बार spasm आता है? मैंने तो कुछ नहीं किया, मैं तो इतनी एक्टिव हूँ, मैं रन करता हूँ, मुझे बैक पेन क्यों होता है? These are all questions that come to mind, right? Yes, it's not just posture. There is a lot of things that contribute to mechanical back pain. There are a lot of research that has been done, obviously, because it's globally such a big problem. There are a lot of research abroad that has happened about back pain and how it works. So, अगर back pain होता है, क्या करते हो आप? What are the steps that you take? What do you do?
A bit stretch,
Stretching नहीं. सबसे पहले क्या करते हो? Ignore करते हो. Yes, everybody ignores. This is a fact. जब पहला episode आता है back pain का, everybody ignores. Oh, but that's a sign, no. It's a sign. Your body has given you a sign. Listen, wake up, pay attention. इसके बारे में कुछ करो, नहीं तो मैं वापस आऊँगा. Next episode will not be so nice. Next episode will be worse. Every episode of back pain, this has been proved in research, by the way. Every episode of back pain, it can be every 3 months, it can be every 15 days, it can be every 3 years. The next episode will always be bigger than most. And when do people go to the doctor या do something about it? जब bedridden हो जाते हैं, bed से उठने को ही नहीं जम रहा है. Stuck. Now you're stuck. हाँ, इतना पेन होगा ना, फिर कुछ हाँ, अब टाइम आ गया. This is a fact. Yeah. When that happens, then you feel like you have to take action. But that action should not come then. The action has to come when the first time you experienced pain. Because what is pain? Pain is a signal telling, your body is telling you, कुछ गड़बड़ है, इसको अभी ठीक करो, कुछ करो. Pay attention. Pay attention. Okay, first step is ignore. What is the second step? What do you do? Stretch, na? But how do you know what stretch to do? आप सही कर रहे हो, गलत कर रहे हो, योगा कर रहे हो, बराबर है. Not everything works for everybody. Okay, our spine is a hugely complex thing. Spine is what? यहाँ से यहाँ तक, tailbone tak. This is the whole spine. What is it? Bones sitting on one on top of the other. बीच में डिस्क है, nerves है, ligaments है, muscles है, highly complex. Lower back pain, that's why all the load comes on the lower back pain, and it's everything that you're doing in life to contribute to it. So grab a chair if you want to stay for the session. ले लो ना. If you want a stable chair, there are more. If you want. मेरे रूम में शालिनी वहां से ले लो. Okay, so today when we go through the checklist of all the things that you have to pay attention to starting today, I want you to make a note. If you say, अच्छा हाँ ये मैं नहीं कर रही हूँ इसलिए मेरे को पेन शायद आ रहा है, या oh this I was not doing, please put it in the group. It will really help me understand you a little bit better. Now, first and foremost thing on my list to talk to you is about awareness. In general, we go through life doing things, cooking, working, getting in and out of bed. Are we aware of us, what we are doing? What do you think? Do you go through life being aware of what your spine is doing? In fact, I just thought about this because I had to pick up that piece of paper. Did you see how I picked up? तो वो मुझे मेरे पेशेंट्स भी पूछते हैं कि आप हमेशा ऐसे करते हो क्या कि हम खड़े हैं इसलिए आप कर रहे हो, बट यस, because it's now second habit. It's so if this paper was on the floor and if I had to pick it up, most of us will go like this. And what about your kitchens and your work where you have cabinets underneath? You will never see me reaching aisa. You will see me doing this. Okay, we have some fancy footwear if you want. Okay, so that is awareness. Just being aware of what you are doing through life. Because back pain जब आता है, episodic back pain, muscle spasm, stiffness, ये जब आती है, it doesn't give you, it doesn't tell you and come. It's just going to happen. And then वो एक के ऊपर एक multiply होता रहता है. So we have to stop it, nip it in the bud. क्या करेंगे इसके लिए? Awareness. Let's talk about awareness. Step number 1. How many times in a day do you think that you bend forward? So many times. तो भी number
50.
50. Okay. Not more than 8 to 10. You should get award if you are bending only 8 to 10 times a day. People who are joining me online, I want you to put it in the group. You'll watch the group. Shalini, wo dekho. Wo phone kholo na. The first group there. Put it in the group, please. Put it in the group. Tell me how many times you bend in a single day.
You also have to answer. हमको भी answer करना है.
5 to 6 times, 50 to 60 are here. So you will just keep a track of it. And if people are asking questions,
back pain workshop, no?
Back pain workshop, yeah. No, Shalini is watching it, so it's fine. Okay, so what are the common responses? 50 to 60, 50 to 30, 30 to 50. Okay, all right. So tell me, आप सबसे पहले उठते हो तो क्या करते हो? उठते ही क्या करते हो आप? योगा टीचर तो is everything doing right.
I do some stretching exercise because of the stiffness in back. I do some stretching there.
Anything in the group? People in the group, please make it interactive. Tell me, what do you do? उठ के पहले क्या करते हो आप? आपका दिन स्टार्ट करने से पहले ब्रश करते हो कि नहीं? ब्रश करते हो ना? ब्रश करते हो क्या करते हो? बेंड करते हो? First thing in the morning when you get up, it is a fact. The first thing that we do in the morning is bending forward. We do not think about that. That brushing our teeth in the morning is bending forward. Our day starts there. And then all through the day, you are doing exactly the same. That's bending of the spine. So bending of the spine starts from here. This is a 15-degree bend forward.
So it's okay to bend the knees here, right?
Yes. So what you can do now, ideally what you should do is bend your knees. If you bend your knees, then your back is still straight. See, versus this, if I do, as compared to knees bent and leaning forward, right? That is something that you can start doing. Yeah, I can show that again. So same rules apply when you are picking up something from the floor. Na? So if you are bending forward, instead of bending like this, where my back goes into a C, what you can do is just do this and brush. So that way your back is still straight.
The curve should be
This has to be maintained. Yes, the lumbar lordosis, the curve should be maintained. Now, another bending is what? Driving. We don't perceive driving as bending. That is, again, you're going in a C. All the curves of your spine, this curve that goes in, this has to be maintained. पर वो maintain नहीं रहता है ना, क्या होता है? आप जब बैठते हो, आप ये करते हो. Sitting is bending. अब बताओ, how much bending you are doing in a day?
So in my car, the car is like this. I take driving like this.
But lower back is going in a C. The lower back is going in a C. Right? So, correct. The point is, we are doing a lot of bending forward in the day.
30% bend is a bending.
Correct.
30% leaning forward
is a lot. But we are doing so much bending. ये कितना होता है? ये कितना होता है? That's all extreme bending forward. Now, when I'm talking about bending, I am talking about what we do through the day, right? I'm not talking about exercise wala bending, because that is controlled. Like in yoga, you do a lot of forward flexion. Forward flexion, when it's done in controlled manner, it is good. But I'm talking about your day to day, when you're not thinking, आपका दिमाग किधर और है, आप फटाफट bend करोगे, spasm आएगा, right? What is bending doing? It's causing this, which does what? The disc starts to get space between the bones. This opens ऐसा, and the disc has space to come out. And वहाँ सब nerves है. The more the compression, the longer that you bend, the more frequently you bend, the more space you have for the disc to come out. And that's where slip disc herniations, all kinds of things happen. Correct. So what do we want to do? We want to be aware of our spine. There is one tool that I have created. It's called Back Habits. I will share that in the group. Over the next 1 week, 10 days, I want all of you to fill that out every single day. आप सोने से पहले आप वो fill up करो. It has all the parameters of what we are discussing today. Just start being aware of what you are doing through the day, and that's going to give you clarity on what are the things that you are doing wrong. क्यों आपका back pain क्यों है आपको, first of all, and क्यों नहीं जा रहा है. Okay, so that was point number 1. Next, we are talking about posture. Posture is a big one when it comes to back pain. Posture, how? Sitting. Sitting, there are a lot of rules we don't think about. The more we sit, the more the pressure builds up in the lower back. For example, I want all of you that you are watching online, I want you to take your finger, I want you to bend it backwards like that. And hold it. Just pull it back and hold it. Okay? ठीक है, अभी पकड़े रखो end of the class तक. चलेगा? What's going to happen? In 5 minutes, you'll do it for few seconds. After that, you'll say, kya ho raha hai? But this is what you're doing to your spine. We can feel this faster because it's a small structure, but this is exactly what your spine is. They are joints and they are muscles. Everything is held together. This is what you're doing with your spine all day long. So just be aware of how much you are sitting without taking a break. इसका solution ऐसा नहीं है, मैं नहीं बोल रही हूँ कि बैठना ही बंद कर दो. That's not possible. It's our work. What are the things that you can do when you sit? You can get up every 30 to 45 minutes. The rule of thumb is what? People who have pain right now, if you are experiencing pain, then the guideline tells us that every 30 minutes you have to get up from a sitting position. I'm not saying उठ के कुछ 15 मिनट कुछ और करो. No, just get up, change the static position. Get up, do some back bends, go talk to a friend, take a phone call, walking, go drink some water, go to the loo. Just break the sitting position. That's point number one. People who don't have pain now, still people who have never had pain, even for them, the rule of thumb is every hour. Before the 1 hour is over, you should be taking a quick stand-up break. So you have avoided this. ये प्रेशर आपने रिलीज कर दिया, फिर आप वापस बैठोगे तो कुछ नहीं होगा. Correct? Does that make sense? Okay. What is the next thing that you'll do? To sit as straight as possible. There are many of my videos that I have told you how to sit properly. This comes in the realm of ergonomics. What is ergonomics? How you are sitting at work in front of your laptop. All my patients who come here who have either neck pain or back pain, my mandatory thing for them is that you will have a colleague take photos of you working, not when you are posing or paying attention, but जब आप काम कर रहे हो, किसी को बोलो photos लेने, I will figure out वहाँ क्या गड़बड़ है that is contributing to your pain, because there are a lot of things. People laptop इस तरफ होगा, ऐसे बैठे हैं, पूरा slouch करके ऐसे करके काम कर रहे हैं. Okay, there are a lot of things that can be corrected. If you want that help from me, please DM me, send me the photos. I will help figure out if there are big things there that are contributing to your pain.
People they sit a lot of time in the sofa.
So working from home during COVID, this happened that most people started working from home. ना अभी rules तो थे नहीं तब कि अब क्या करें, office setup तो बराबर था, वो एक हो गया, but what about at home? Even now people are working from home. So an excellent point he made was अभी भी लोग घर से काम कर रहे हैं. कहाँ से? डाइनिंग टेबल शायद फ्री नहीं है, मे बी टेबल chair setup is not there, but I say if you are going to work any more than 1.5 hours from home, you must have a table chair setup. अगर वो नहीं है तो you will make all the classic mistakes. Working from bed, not okay. Working from sofa, not okay. Working from the floor, not okay. You have to invest in a proper table and chair, because it's this, the more continuous that you are abusing your back by sitting in poor postures, the more you're creating trouble, you're making your spine weak, right? That's what we want to avoid. So those are the sitting postures. But if I ask you कि अच्छा कल से मंडे ना, कल से आप काम पे जाएंगे, आप एकदम स्ट्रेट बैठेंगे, बिल्कुल स्लाउच नहीं करना है आपको. Do you think that's possible? People tell me in the group 8 hours, 10 hours, like right now. We'll see how long you'll sit. Back एकदम ऐसा straight होना चाहिए. How long do you think you can maintain that posture?
Slowly, you can improve.
20 minutes? वो भी बहुत है. पता है क्या लगता है? Do you know what it needs to have to sit upright? You need so much core strength. This part of your body is your core. How many of us are working on our core enough that we'll be able to sit for 1 hour? Like when you have people sit in meditation, back erect रखने बोलते हो ना? How many can do that? It's very tough. Block रखो, cushion रखो.
I do 1 hour meditation fast, but I don't.
Your back may not be so erect.
But I don't know. I won't be deep. I don't know. But most the start is always straight.
Sit. 1 second. You'll keep an eye out ना, कोई आ रहा है जा रहा है तो 1%. There's water filter there. Okay. हाँ, so in order to sit upright, अगर meditation में बैठना है, काम पे एकदम straight बैठना है without back support, that requires a lot of core strength, and that most of us don't have. Okay, unless you have worked on your core in a very systematic way by doing specific exercises. And core, I can talk about core for 5 hours, and I also teach core workshops a lot. Because there are so many myths around the core. People think कि crunches किया तो हो गया, planks किया तो हो गया. That's absolutely incorrect. So, if you're interested to learn more about how you can make your core stronger, please DM me. I will send you resources. There are playlists, there are workshops. There's a lot. So, what will you have to do then? in order to sit upright, in order to maintain this curve of the body, what will you do? You will use an external support. Okay, you want to pull up your chair? Just bring your chair. Let me just demo this quickly. Sit. What's your name? Sorry. Dilip. So if Dilip has to, I tell him, Dilip, पूरा दिन सीधा ऐसा बैठो. कितनी देर बैठेगा वो? Not possible. So okay. So now relax. You don't sit like this, Dilip. Relax.
I'm relaxed.
Okay, so conscious, yeah, some amount of consciousness has already come. So now if he is going to relax, his lower back is going to start slouching. Okay, you can slouch a little bit more. This is how typically Dilip is sitting and working. Now, वो curve तो चला गया lower back का, because what is the curve? यहाँ से straight करो this. अब ये chair में तो supported है नहीं. So what do we need? We need some external support like that. Does that make you sit upright with your back is supported, feeling supported?
Yeah.
Okay, you can go. Okay, now it doesn't have to be exactly this, but this is a McKenzie roll. Something similar we need in order to support the lower back. A lot of people use the full supports, that's okay, but I find something that pushes this part as a straight, that makes a bigger difference. So if you have back pain,
Covers, cushion over there. I can them, but not that hard.
it has to be that much. It has to push your back out. आपको slouch करने देना ही नहीं चाहिए उसमें. Okay, so that's what you will have to start doing. So that's about sitting. What about sleeping? Do you think sleeping postures matter?
Yes.
They matter. How many of you are tummy sleepers here? Put it in the group, guys. People joining online. Any tummy sleepers here? You're used to sleeping on your tummy? Any comments? Okay. So, no tummy sleepers here. So, let me tell you this as a rule of thumb, sleeping on the tummy, not such a great idea. It puts your neck at a very weird position, especially if you have a pillow, your neck is going in a weird position. It can give you a lot of stiffness when you wake up in the morning. What is a great way to sleep? To sleep on your side with a pillow between the knees, because then your thighs are parallel to each other. Strain doesn't build up in the hip and the lower back. Now, सबको ये करने की जरूरत है क्या? Not necessarily, but if you had pain or if you have pain now, this is one thing that you can do to alleviate some of the stress and strain that's building up. People who have stiffness and pain first thing in the morning, प्लीज आपका स्लीपिंग पोस्चर पे ध्यान दो, बिकॉज वहां कुछ गड़बड़ चल रही. बिकॉज व्हेन वी स्लीप देन वी डोंट रियलाइज कि कैसे हम सो रहे हैं ना, वी डोंट नो, बट मे बी just start being a little bit more aware of that, because sometimes when you are paying attention, then those clues come to you. But the people who are having first thing in the morning pain, एक और चीज करना है आपको mattress check करनी है आपकी. What is your mattress like? Is it firm? Is it soft? Is it super soft? Spring one. Firm? Okay, put in the group. Tell me, what is your mattress like? If you don't know, then you can say don't know, because a lot of people don't know. Mattress कैसा है, कभी ध्यान ही नहीं दिया. अगर आप अपना मैट्रेस every 3 months पे फ्लिप नहीं करते हैं, तो वो भी एक प्रॉब्लम है. Flip. You're supposed to flip your mattress every 3 months. So 4 times a year it has to be flipped. Why? Because your body has taken the shape, or everything is now stuck there, right? It has to be flipped. So people with stiffness and pain, waking up with pain in the morning can mean 2 things. One, sleeping posture. It can also mean that your mattress is wrong, but it can also mean that you have some underlying disc issue. Disc problems show up first thing in the morning. First thing in the morning, pain, stiffness, muscle spasm, difficulty getting up. उठने के बाद, बेड से उठने के बाद, you're stuck in a flexion position. फिर थोड़ी देर चल के फिर सीधे होते हैं. This is classic signs of disc. So if this is you, then you want to look at and change some of these things.
What about right now the memory foam mattresses are and they do not change the shape. No?
So that's also a good question. Now you do have memory foam mattresses, which they say that you don't need to really flip or change, but things like that. But you have to pay attention to maintenance. Nothing lasts forever. Everything has things. There is wear and tear for everything, right? So yes, for those you don't necessarily need to flip, but make sure the maintenance protocols you're following for that. Does everybody need memory foam pillow mattresses? No. Okay, everybody does not need memory foam mattresses. If you have back pain, it doesn't mean you sleep on the floor. It doesn't mean कि भाग के जाके memory foam mattress ले आओ. Basic rules पहले follow करो. There are so many other things you can be doing also to help that. Yes, one big thing that I wanted to, as a conceptual thing, I want to explain to you is about causes and triggers. Do you understand the difference between that? What has caused your back pain and what are the triggers for your back pain? What is the difference? Tell me in the group. आज अगर आप you woke up in the morning with back pain, now you have a horrible day, पूरा दिन spasm है, back pain है. What was the trigger? What is the cause? They are two different things. You have to understand that. So please pay attention. You want to know the difference. The cause, overall cause is holistically, what is the cause? What are all the things? Maybe you're bending too much. Maybe it's your sleeping posture. Maybe it's your mattress. Maybe you're sitting 8 hours straight without getting up. Those are the causes. Maybe your back is not very strong. Maybe you're doing the wrong exercises. Maybe you've never invested in core strength. Your core is really poor. These can be the causes. Now, what are the triggers? Triggers are those small things that has done this. So, classic example that I used to give people, classically how back pain ऐसा तुरंत कैसे spasm कैसे चालू होता है, you have to think about trigger क्या था. कोई भी आएगा पेन लेके, I will ask what was the trigger? Cause, I have to find the cause. I will figure out the cause for them. Yes, your core is weak, you know, all that causes I will find for them. But the trigger, what was the trigger that brought this episode on? ये particular episode चालू कैसा हुआ? अगर आपको ये ट्रिगर आपका नहीं पता है, आप बार बार वही करते रहोगे ना, आप उसको करेक्ट ही नहीं करोगे. ट्रिगर क्या था? People will say, oh yeah, I picked up my daughter, I didn't realize कि उससे ही मेरा back spasm हो सकता है. पर हो सकता है. Because the cause was what? That your back was not strong enough to pick up your daughter who weighed an X amount. But the trigger was that you picked her up. Or it can be, or वो, sometimes it's not very obvious. People will think, अरे I don't know कैसे back pain चालू हो गया. I said, कल के दिन में या 2 दिन में आपने क्या अलग किया? सोचो. What was something different than your usual that you have done? It can be, oh yeah, of course, I had to go to a meeting to Andheri and I drove for 2.5 hours. That was a trigger. Does that make sense? So figure out the big causes, what has caused, why you have back pain, but figure out the individual triggers also. The more you limit your triggers, the better off you will be. Okay, does that make sense? People joining online, please tell me in the group, put comments, let me know what, till now, what is resonating with you. What are the things that you think are your causes, your triggers? Tell me. Put it in the group, please.
Forward bending, overload, prolonged activity.
Forward bending, overload, prolonged activity. Yes. Okay. Due to injury. Yes.
Cause and forward bending is trigger.
Great. So everyone in the group, please, I want you to think about it. Put your big cause and put your triggers. I want you to put it. And of course, over the next 1 week, we're all going to be in touch. You are going to fill out the back habit, all of you. For 1 week, 10 days before you sleep, you will think about what you've done in the whole day. Just be aware of all of those things. I will be sharing it in the group. Yeah?
Interval running.
Interval running is a trigger or a cause. That's not cause, that's trigger.
Squats.
Squats. Yes, yeah, we are coming to exercise. Okay. So we spoke about awareness. This was all about awareness. How do you sit, stand, walk? आजकल standing बहुत कम है ना. We don't stand as much. But women who cook, they are standing. We don't think about that. Maybe you've got to drop your child to a class and there you have to do standing. There are some times that we are standing. Standing में क्या गड़बड़ हो सकती है? Standing on this. पूरा full body weight on one hip. That causes what? Lot of torsion in the lower back. Also, what about sitting with the leg crossed?
Yeah.
Again, because if you think about it, हम एक ही पैर क्रॉस करते हैं हमेशा. सबका अलग है. पर we have that one comfort thing कि हम अगर सोफे पे भी बैठे एक पैर ऐसा नीचे अंदर लेके बैठते हैं.
Standing also.
I'll come to that.
Even standing also.
Crossing the leg and sitting down is a bad posture.
Wait. I'm turning it. That posture. Yes, mostly like that. Wrong. What are you doing? Don't just think about, हाँ ठीक है थोड़ी देर के लिए चलेगा, but start thinking about this. The longer you sit, this is what you're doing to the hip joint.
Yeah.
That's what you're doing to the lower back, because lower back mein what are you doing? You're causing torsion, rotation of the lower. So when your lower back ka spine start rotating, the upper ka everything has to compensate, right? One side ka muscle. I had somebody who I had gone for an ergonomic checkup at her workplace. Back pain for months, years, jai nahi rahe jai, all kinds of treatments. Everything has been done. I go to a workplace and she sits, पैर तो क्रॉस किया ही है, and then leaning over and working. हाँ मतलब one hand is always rested on this. So can you stop doing that? I think तुम्हारा pain चला जाएगा. 2 weeks later pain is gone, no treatment, no nothing. Okay, so it is that powerful. We have to think about how we are sitting, because those are all torsion. Now you will say कि अरे आप तो हिटलर जैसा बात करो, ये भी नहीं करना है, वो भी नहीं करना है, कितना सोचना है, क्या क्या करना है. I have patients who have said that कि बेड पे बैठ के हम टीवी नहीं देखेंगे, ऐसा बैठ के शो नहीं देखेंगे तो कैसा लाइफ चलेगा. Yes. There are many patients like that, that if I do 10 sessions of physiotherapy for them, I can get them better. But I tell them, look, अगर हमने आपका कॉज ठीक नहीं किया है, आप 3 महीने बाद वापस आओगे पेन के साथ. मैं नहीं चाहती हूँ ये. We have to figure out what your cause is. We have to fix that. So sometimes they send me photos. I said इसमें से इतना change करो, इसके बाद आपको तकलीफ नहीं होगी. या आप mattress change, whatever. Use a neck pillow. There are many. Of course, the cause you have to figure out. If you need me to figure out, I can help you with that, because there are XYZ things that I can ask you questions may and understand that from you. So that, okay. Now let's talk about, do you think that stress causes back pain? Yes. People are now getting more and more aware of this. Okay. Ab tak there was people don't want to think about stress. Stress causes everything, but stress also causes back pain. Think about yourself. People joining online, I want you to put it in the group. When you are stressed, where do you feel it in the body? Hi. Where do you feel it? Put it in the group, please tell me. When you feel stressed, where do you feel it in the body? I'll give you my example. You know that I have a fully functional clinic, Monday to Saturday. Every day I'm here. On Sundays, like today, I'm teaching a workshop. Sometimes my Saturdays are busier than the weekdays. So I'm working every day of the week. So I have to take breaks. Thursday is my non-clinical day. That day I don't necessarily work. I end up working, but I don't do a lot. So I know the minute that I start feeling stiffness, I'll feel मेरा neck अभी एकदम ऐसा stiff होने लग गया है, and it's a slowly headache चालू हो रहा है. I know that is a sign that I have overexerted. And now my body is giving me a signal that look, something is going on. There is some stress. I know overwork is one, but even emotionally, if I am stressed, it shows up for me. My neck becomes ऐसा जकड़ जाता है. and then I'll start getting a headache. Okay, मैं कितना भी सोऊंगी, कितना भी medicine लूंगी, कुछ भी करूंगी, जाएगा नहीं. Lower back and neck. Stress. Everyone holds their stress somewhere in the body. For you, every time it will show up there. So I want you to think about it. Next time you have back pain, could it be that you are stressed? Could it be? Now, who doesn't have stress? What is stress? It's a normal, common. Sabko hota hai stress. And stress is good because it helps us grow. Stress is telling us something. Like pain is telling your body something. Stress is telling our mind something. Something about this situation needs to change. That's what stress is. Either we learn how to manage it well or we change the situation. So if you have stress, there's a huge mind-body connection. Please do not forget that aspect of it. There are, especially if you have chronic pain. Do you understand the difference between acute, subacute and chronic pain? What is acute? Tell me. Those who are attending online, tell me. Acute pain क्या है, subacute क्या है, chronic क्या है? Acute मतलब anything in the group? Guys, come on, people joining online, talk to me.
You are living in that.
That's not chronic means. I'll tell you.
Acute within 2 months, chronic more than 6 months.
Yes. Actually, the definitions are 2 weeks and under pain is acute pain. Sometimes it's also acute pain is also the intensity of pain, the severity of pain. You should know how to scale your pain. 0 to 10 आपको कितना पेन है. अगर आपको अभी बैक पेन है या कहीं भी आपके बॉडी में पेन है, आपको पता होना चाहिए उसका नंबर क्या है. इनफैक्ट आई क्वेश्चन माई पेशेंट्स टू डेथ. अभी कितना पेन है अभी बताओ. Some of my patients are so aware that they'll say, हाँ 4.5 पेन है या 4.75 पेन है. And that's good. That means they're so aware. फिर वो 4.75 से अगर 4.5 तक हो गया तो ऐसा yes, that's progress. मतलब pain has reduced a little bit. Okay, so that though इतना awareness चाहिए. So you should know on a pain scale. Acute is what? Pain that is above 5. Acute pain, severe pain, less than 2 weeks. First 2 days is considered definitely very acute pain. Anything over 2 weeks becomes subacute. Acute pain mein treatment protocol is different, which I will explain to you. Subacute phase, 2 weeks to 3 months, treatment protocol is different. And 3 months and above, agar aapke back pain ko, even if it is intermittent, even if it is episodic in nature, if अगर आपको 3 महीने से ज़्यादा हो गया है thinking about back pain या आपको है back pain या था back pain, then this is considered chronic. People with chronic back pain, now it's not just a body thing, now it has taken over the mind because now you're going to think about it. Okay, now you're worried about it. Second, third episode हो गया, तीसरी बार हो रहा है मेरे साथ ये, क्यों हो रहा है मेरे साथ ऐसा. फिर as usual what do? We blame our parents. For everything we go back to our parents. उनके वजह से. This is genetic. This is all genetic in nature. There is a very small fraction of genetic association for back pain. Majority of the problem is you because you are abusing the back. There are all these things that you're doing that you're not right. Okay, so if we can correct some of those things, it goes away. Acute, subacute, chronic. People with chronic pain, you have to manage. You don't want to get attached to your pain. You need to look for healthier ways to treat your pain. Please remember that now it has become a stressor and chronic pain is very difficult, quite difficult to reverse. When it is acute, it is quick. When it is subacute, there is a way to treat it and it of course goes away. And then chronic is much more difficult to reverse. But when you do reverse it, you want to think about what can I do so that ये pain, ये episode मुझे वापस ना आए. You have to put all the measures in place for that. Okay, let's talk about fitness. What are the things, exercises that you are doing or not doing that is contributing to your back pain or not allowing your back pain to get better? Share. From everything that you have understood till now, tell me, what is it, exercise या fitness किसी में, maybe it is a past experience or maybe you're doing it now. What is it that could be contributing to your pain? Either आपका pain बढ़ रहा है या ठीक नहीं हो रहा है या episode आया because of that particular thing. Please put it in the group, let me know.
Forward bending.
Exercise. What forward bending? Forward bending exercises you're saying. Okay, like I said, if it is controlled, then it's okay. But yes, if you're in acute pain and your spine needs to extend, do extension, and you're doing a lot of forward bending movements, then yes, then that is definitely one of them.
Squats, running,
Squats and running can, okay.
bridging, jumping high.
So running doesn't necessarily increase back pain, okay? If your core is strong, if you're doing all the correct things, then that's not necessarily. But if you think that every time you run, आके मुझे back pain होता है, तो then there are things that you can fix for that.
For me, the back end subsides when I do yoga.
Yes, so that's what helps your back. I'm asking, what is it that you have understood or you know that, okay, if I do this, maybe this is why my back pain is not increasing, या मैंने वो किया था उसके बाद मेरा back pain बढ़ा था. Put it in the group, let me know.
For me, I think the back pain is actually the feet pain, when I got flat feet.
Yeah, thank you for saying that.
Here. I don't have pain here, but that pain is coming here. Because
Yes.
of overrated.
We will come to that. We will come to that. We'll talk about alignment in a minute. Not no warm up. Yes, great points. Good. I want you to start thinking, because these are exercises or things that you're not doing wrong, not doing right, that are causing. So, point number 1, are you doing a balanced form of exercise? Are you including mobility along with strength, or are you doing only cardio? If you are running, then are you making sure that you're doing foam rolling and mobility and strength along with it? Is your exercise routine balanced? Think about that. If no, then that's one of the reasons why you could be having repetitive back pain. Because a lot of people will say, नहीं हमको योगा जम रहा है तो खाली योगा जम रहा है, हम और कुछ नहीं करेंगे. या कोई बोलेगा मुझे रनिंग बहुत अच्छा लगता है, मैं खाली रनिंग करूंगा, मुझे और कुछ नहीं करना है. These are the pitfalls. So you have to balance it out. Your body doesn't need only one thing. Please remember, your spine moves in many directions. What are the directions? Forward, back, rotations, and side bends. All these movements your spine needs on a regular basis. Balancing, yes, that also affects the back. Okay. Rotators, yes. So if hip flexibility makes a big difference, absolutely, because so everything does. अगर ये lower back है, whatever is happening ऊपर, मतलब आपका posture ऐसा rounded आप करके बैठ रहे हो, walk भी ऐसे कर रहे हो, then that's going to affect the lower back. If your hip muscles are very weak, or if they are immobile, very stiff, then that also causes lower back. So you have to think about what in your exercise routine can you improve. The biggest thing that you can do, the best thing that you can do, one is improve the mobility of your lower back and your hip. The other thing that you can do is improve your core strength. That brings me to the wrong exercises being done. If you have ever had back pain, then the exercises that I don't want you to do. I have made a video on this and I try to tell everybody that I meet, please don't do crunches. Because crunches are one of those that put excessive strain on the lower back. And please remember, आप बोलोगे नहीं मैं तो करती हूँ crunches पर मेरे को कुछ नहीं होता है. आज नहीं हो रहा है. आप stress को build up कर रहे हो. The more number of reps that you will do with crunches, one fine day your back is going to say बस मेरे पास इतनी ही ताकत थी, मैंने इतना ही किया है, अब आगे तुम देख लो. Then the disc will get affected. Okay. So if you, I'm not saying as a blanket rule, I used to say stop doing crunches, but now I'm putting a caveat. If you have had a history of back pain, don't do crunches. There are so many better exercises you can be doing. I teach 10 sessions of core program. This is 5 weeks, 10 sessions of core program. Not a single crunch Not a single one, because we don't need crunches. But the problem is people don't want to be creative with exercise. ये 5 exercise है हमारे पास, हम ये 5 करेंगे. The other one is lying down, both legs lifting up together. Crunches are sit-ups. I hope everybody knows what crunches and sit-ups are. Okay, the other one is a roll-up, Pilates ka roll-up, fully coming up. If you have decent core strength and your back is strong, you can do that. Most people don't have good core strength. So that's when they'll do 2 or 3 of these exercises. 2-3 months tak अच्छे से चलेगा. Recently we've had a case. How many people I've seen in the clinic coming with a deadlift gone wrong or a crunch? Crunches करते वक्त pain चालू हो गया. How many? Deadlifts. It's a big one. Okay, and I know my athletes will tell me, अरे हम तो deadlifts बहुत करते हैं. करो. You are an athlete. You have built your core. अगर आपका foundation core का है अच्छा, आपका back strong है, do it. But most of the time, deadlift में it's all about where your spine is. If you have overarched your back while you're doing a deadlift, or if your back is curved, either one can get in trouble. And then of course you're loading it, right? The more the weight, all the weight is going here. So please be careful. I will send you that video of the exercises not to be done if you ever have had back pain. I've demonstrated those exercises. So these are the exercises that I hate and I don't want it to be a part of your vocabulary. There are so many better exercises. Do side plank, bridges, do variations of all of these. That's more holistic. Work on your gluteus medius. Okay, so a lot of exercises that are getting missed because people fall in the trap of ये बस 5 exercise, squats, lunges, plank, crunches, deadlift. कर लिया खत्म, workout is over. But you're not realizing you're making your back worse. It may not happen today. It may happen 3 months down the line, but then it may be a very bad episode, difficult to reverse. Okay, none of this, what I'm telling you guys today, is to be scared. It is just as a caution. It's just things that you can not do or do in order to make your back pain go away. Okay, let's talk about treatments. What are the kinds of treatments that you can do to help pain? People with chronic pain, they invariably feel a lot of stiffness around the lower back here. And there are some deep muscles here in the spine. Quadratus lumborum is one muscle, very deep. As historically, jisko bhi back pain hai, if you check that muscle, it's definitely, there is a trigger point there. That muscle has tightened up. These are protective spasms, by the way. When we have an episode of pain, our body goes into a protective spasm. And it doesn't know how to let go. So, episode to chala gaya, par wo andar ke muscles abhi bhi aise pakad ke baithe. That's why the residual stiffness that you feel for years together, even when the pain is gone. And if that ek side ka muscle stiff hai, don't you think that's an imbalance getting created everywhere? That later can lead to another muscle spasm on the opposite side of the back. So QL is a very important muscle. You have to make sure that that muscle is opened either with trigger point release or with massages or with needling, with foam rolling, things like that. Okay, so that's one. So that's for people with chronic pain. But even now, if you do have acute pain, I want you to look at that point there. Either have somebody check that point कि वहाँ वो stiff है कि नहीं, painful है कि नहीं. Or the one that I show my patients is just lie down, put a ball exactly there on the side of the spine. See if that's painful. If that's painful, then that muscle is tight, it's stiff. Work on your hip mobility, open your glutes, make your glutes strong. That's another big thing that you must do. Most people today are glute deficient. Glutes are not working. Why are they not working? Because you're sitting so much. So, agar hamara primary काम sitting hai, when you're sitting, the glutes are completely sleeping. Then when you stand up and walk, they're still sleeping. And if your glutes are the big muscle that you sit on, right? The butt muscle. This is our powerhouse of strength. If this is not strong, all the load is coming to the lower back. Please remember that the first thing that you can do is start working on your glutes and your core. That's going to prevent your back pain. Now, people with acute pain, if you have pain in the first 2 weeks, what should you do? Always use an ice pack. Okay, I don't care who has told you, दादी ने बोला है, किसी physician ने, किसी ने family friend ने बोला है, because the minute you share with people that you have back pain, सब लोग आपको advice देना शुरू कर देते हैं. Is that right or wrong? बस बोलने की जरूरत है back pain. अरे तूने ये try किया क्या? Tell me if it's a fact or not. Please put it in the group if this has happened to you. It has happened to everyone. बिकॉज सबके पास वो एक सॉल्यूशन है जो वर्क करता है. वो सॉल्यूशन आपके लिए सही नहीं होगा शायद. ओके, एवरीवन इज डिफरेंट, आवर बॉडीज आर डिफरेंट. यू हैव टू लुक एट इट लॉजिकली एंड सी व्हाट वर्क्स, बिकॉज देयर आर लॉट ऑफ फैड्स दैट विल कम अप कि ओके दिस पर्टिकुलर थिंग, अभी इंस्टा पे ये ट्रीटमेंट बहुत चल रही है, अब ये हम ट्रीटमेंट ट्राई करेंगे. होता है ना? It's very frustrating as medicos to go through that because people follow all these things and then 3 months later they are back to the clinic. क्या हुआ? बैक पेन आ गया वापस? ठीक है, चलो अभी इसको ठीक से ट्रीट करते हैं. Yes, so you want to listen to experts, not influencers. Yeah. So
orthopedic doctor or direct to a physiotherapist or what?
See, it depends. If you have a muscle spasm and it's acute pain, its severity is under 5, it's okay to go to a physio because a physio actually can walk you through the things that you are doing wrong and help you figure that out also, along with taking care of the pain. Who should go to an ortho? People who have persistent pain that's not going away with treatments. If you have any radicular pain is pain that's moving, back से अभी नीचे जा रहा है, tingling numbness, please go to an ortho. Maybe you need an MRI. But the fact is that about 60-70% of back pain is is mechanical, meaning that it's not coming from anything. MRI में कुछ नहीं आने वाला है, पर फिर भी आपको back pain है. That means there are all these things that we talked about. Those are the contributory factors. So if you can fix that, then the pain goes away, right? So your first line of treatment has to be ice pack, not hot pack. Who here is using hot packs for their lower back pain, acute pain? Put in the group, please. You've used hot pack or are using hot pack to treat your back pain?
Pain balm user.
Any of these topical things are okay. That's not going to make or break anything. It might help to some extent, but it's not going to. Yes, balm, yes, and that's okay. Topical, all those are okay. I'm not saying no. What I'm saying is, what are you doing to actively manage your pain? What is the ice pack going to do? It's going to control the inflammation. Because acute pain जब होता है, जब pain episode अभी चालू है, there's a lot of swelling and inflammation that has built up. Even if it is a muscle spasm, the ice pack is going to control that. So the first 24 to 48 hours, you will never use a hot pack, no matter what anybody is telling you. उसके बाद, if your pain has reduced, then you can switch to a hot pack.
Even balm.
Okay, balm is okay. Balm कभी भी use किया तो, like I said, it's not a big mover. It's not going to make or break anything. It might give you some symptomatic relief. By all means, use it. That's okay. But what you don't want to do is rest for an extended period of time. 15 दिन बस अभी bed rest करना है. That again makes your back stiff. What you don't want to do is get addicted to the back belt. Back belt पहना है, मैं कितना ही देखती हूँ यहाँ शिवाजी पार्क में. People are walking, आराम से walk करे पर back belt पहन के. अरे क्यों? Get rid of that back belt. What are you doing with the back belt? You're making your back weak. आप अपने muscles को काम करने ही नहीं दे रहे हो, तो काम करेंगे कैसे? वो weak ही होते जा रहे हैं ना. Same thing, my philosophy, no external supports, no knee braces, no back belts, nothing. अगर acute phase में आपको जरूरत है, आपके डॉक्टर ने बोला है 2 दिन back belt पहनो, rest करो, ice करो. That's okay. So acute phase treatment is what? Ice pack, rest. Uh, Depending on severity, maybe full bed rest hoga, but rarely, I think in all these years I've had 3 to 4 patients that I've said go home. I've sent them home from here only. ट्रीटमेंट अब भी कुछ नहीं करेंगे, हम कुछ भी करेंगे तो बढ़ जाए, आप घर जाओ 3 दिन, you will do ice, you will do medicine to reduce inflammation, you will rest. But other than that, most people are okay just by not doing the things that make the pain worse. Avoid your triggers, do ice pack, and listen. Common sense. Just use common sense. Don't do excessive movement. Don't start stretching in all different ways. कि हाँ ये stretch से शायद ठीक हो जाएगा, या हाँ उसमें मैंने देखा था ये exercise करेंगे तो ठीक हो जाएगा. Acute phase में manage it. The better you manage on day 1 acute phase, it does not go to subacute. Subacute is now you've crossed 2 weeks. At this point, if the pain level is high, you still want to do ice packs. If the pain level has come in control, you can do now hot pack. Okay, chronic pain generally responds better to hot pack. However, chronic pain में ऐसा भी हो सकता है ना कि 3 महीने से कुछ नहीं हुआ है. You, for example, now today I have pain. Yes, you have chronic pain. You have pain for years together. This is in chronic pain, but this is an acute episode. So what should you do? Ice pack. Right? As compared to somebody who has constant pain every day for 3 months, 4 months, 5 months, a rose pain hai. It may not be constant, it may be intermittent, but every day there is pain. This person now will probably respond better to hot pack. You understood the difference? Okay. So exercises that you should do, like I said, please invest in core strength. Please meet an expert that will guide you, because Google can only take you so far, and it's sometimes half information is more dangerous than no information. So you want to understand your spine a little bit better. Follow the back habits tracker that I'm giving you. Track your habits for 1 week, 10 days. It will give you a lot of insight. What is my favorite exercise for back pain? It's the backward bending and Bhujangasana. Okay. About, I will say, 85-90% of pain with back pain. Now, I'm saying this, but please remember that there are several of my patients that have stopped them from doing extensions. I've put them on a flexion protocol. So if you see our clinical notes, if it is spine, back pain hai unko, they'll be in big flexion protocol, extension protocol. Because there is a phase when only one direction works for them. For 80-90% of the case, it's extension, which means backward bending. For about 15-20-25% of people, it's flexion, bending forward. So in acute phases, when we are keeping people on extension, we say stop yoga for 2 weeks. Because yoga has a lot of flexion moves. Or if you go, you will modify, you will do only the backward moves, you will not do the forward moves. Okay? But this is for a short period of time, because eventually your back has to move in all directions. Right? So, extension. So, my favorite exercise, one is Bhujangasana. Do you all know Bhujangasana? Everyone knows Bhujangasana. Please put it in the group if you know that. So, there is one set of exercises that you can do, which I am happy to share the video. You can do this first thing in the morning to keep your back nice and mobile and flexible. Okay, it's a back mobility program. This will keep your back mobile. If you're saying, nahi, already I'm doing a lot of mobility stuff, I want to work on strength.
The stiffness. That last one, when I tell so
Correct. Like I said, this is all accumulative. 1 month तक वो इतना ही रहेगा, वो चला जाता है, धीरे धीरे वो टाइम बढ़ते जाएगा, फिर आधा दिन स्टिफ रहेगा. Everything that we spoke about today, sir.
Will butterfly stroke and back stroke in swimming help?
Swimming is a great exercise. I'm glad you brought that up. Swimming does keep your core strong. It is a good combination of core plus cardio. But again, think about mobility है क्या कुछ? फिर mobility add करो, yoga भी करो साथ में. Got it?
I do meditation, yoga, swimming, walking.
Sure. So if it's a combined thing like that, then it's fine. Then you are making sure that strength, core strength, you're not doing. So one more point that quickly I want to make is people who are flat-footed. The reason why we did the camp today is if your feet are flat or if you overpronate, which means your feet are somewhat dropping in, what does that do? The minute our feet drop inwards, the knees also come in. See what that does to the hip. Your hips are internally rotated now and all the pressure is building up on the back. Eventually people with flat foot, if they do activities, or eventually the back pain chalu hota hai. So all of you, I want you to put it in the group. Tell me if you know whether you're flat footed or not. That's why we do these camps, so that you understand whether that's a contributing factor. It's a huge contributing factor. Like I told you, back pain wale jab during treatment, one, I get their worked photos, but second, I'm always checking their feet. Overpronation है क्या, कुछ correction की जरूरत है क्या, foot exercises की जरूरत है क्या. There are a lot of things that you can do to correct that. Okay, so my go-to exercises, Bhujangasana and back bends. Bhujangasana is lying down, full press ups. You'll show, just show quickly. You know how to do. करो करो. अभी तो पहले फर्स्ट आए थे तो. That's also okay. Yes, that's a Bhujangasana. You don't want to hold it, you're just going in and out. Remember to keep your back relaxed in this position. You're not using your back muscles, you are only doing the movement, you're giving your spine some extension that it needs. This one, obviously, you have to lie down and do it, but through the day, could you do that during your breaks? Just stand and do back bends. Because what are we doing? We are negating the 2000 times that we bend in the day. I didn't give you the answer, na? 2000 to 3000 times a day we are bending. Yes. Yes, that's how much we are bending. So kuch to kare to reverse the effect. So what are we going to do to reverse it? Backward bending. Because forward bending तो इतना कर लिया, करते ही नहीं. कौन करता है backward bending? कोई नहीं करता.
I was supposed to do back bends, but my breath gets.
That is just a matter of practice. That's a matter of practice. That means you're not using your diaphragm and your core properly.
Do several times in a day.
Good, 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 good. Okay, now if a doctor has told you not to do backward bending, please don't do backward bending. I don't know individually आपका क्या problem है, बराबर? But as a rule of thumb, 85, 90, 95% of people get better with managing their pain if they do these two exercises. Cool? Okay, so that's the end of today's session. Now, where can you go with this information? One, you'll fill out the back tracker. Second, if you need any assistance with me checking your back, please come to the clinic. I will help you with that. If you feel core strength is something that you need to work on, my next batch of BBC will be starting soon. So express your interest. I will add you in the group. Next batch jab hoga, मैं आपको बता दूंगी. Spine mobility and flexibility के routines हैं which I'm happy to share with you. So whatever it is that you need resources from me, please ask and it will be yours. All right. So join my forum because all these updates will come to you. I do at least once a month, I do a free workshop or a webinar. It is on different topics. For runners, I do a lot. For core, I do. For spine, I do many through the year. At least once a month I do. And then I have some paid courses which are workshops, 1 hour, 2 hour workout workshops. We have camps here which are, you know, it's great to explore different things because you don't know what is going to help you in the long run. All right, so closing the session.
Stiffness is any nothing.
One second, let me close this.
Wrong postures, you know.
More questions, please put it in the group. Closing the session.
So what's the group 2 after that group?